A new report out this morning from the Canadian Institute for Health Information estimates healthcare spending will grow almost 2% faster than the economy.
CTV's Scott Hurst is following this story and joins us live with the latest. Scott, good morning. So a new report from the Canadian Institute for Health Research says health spending is expected to exceed our economic growth. How are inflation and a population increase driving public sector spending?
Good morning, Nick and Jen. Healthcare spending is rising in Canada, but it doesn't specifically mean that there's a direct impact on care or the services provided, as a new report detailing health spending in Canada really shows inflation as one of the main drivers, emphasizing the need for innovation in how care is delivered. So the 2025 report is projecting that health spending will be at $399 billion, and the cost to deliver care is expected to outpace economic growth, pointing to inflationary pressure, population growth, and an aging population. So as the report points out, in the current environment, simply boosting spending is increasingly difficult. It's not just about throwing money at the problem, meaning spending alone cannot address the challenges impacting patients and care providers. So as a surgeon prides themselves on precision, investments in healthcare need to be made where they can truly make a difference. Without innovation, spending alone will not address the challenges. And as you're seeing by the graphic right here on your screen, the major areas of spending include hospitals really eating up the biggest chunk there, about 26% of total health expenditures in 2025. And employee compensation remains the single largest expense for Canadian hospitals, accounting for nearly 2/3 of all hospital costs, followed by physicians at just under 14% and drug expenditures up there as well at 13%. Those are all expected to represent more than 50% of total health spending in Canada. So it's really about how we spend and innovation versus how much is being spent right now, according to this report.
All right, that is CTV's Scott Hurst live for us this morning. Scott, thank you.